Okay, let's go. Now we're gonna start with mixed questions and like few questions, and then we'll go to the second part of the GI. Now, if you are a 25-year-old female with bilateral non-focal chest tenderness with diffuse cord-like thickening of the breast,
Bilateral non-focal chest
tenderness with diffuse cord-like thickening of the breast.
cord-like thickening.
What is your diagnosis? This is fibrocystic changes. Okay, this is it's called diffuse nodulocystic masses, while breast cysts present with solitary well circumscribed mass. Fibroadenoma mobile well circumscribed mass, cyclical tenderness. Fat necrosis cause firm irregular mass, plus minus ecchymosis and nipple retraction. Now, if you are a 65-year-old female who states that the food drops out of her mouth and having some discharge in her left ear recently, and examination shows left ear canal granulation, facial asymmetry. So what organism causes this?
Is it Pseudomonas?
Pseudomonas malignant otitis externa. Okay, let's. So the anti-pseudomonal medications, we have anti-pseudomonal penicillin like ticarcillin and piperacillin, cephalosporin like ceftazidime 3rd generation, cefepime 4th generation, aminoglycoside, amikacin, gentamicin, or tobramycin, fluoroquinolone like ciprofloxacin and levofloxacin, and monobactam like aztreonam, and carbapenem like meropenem and imipenem. You know, I'm energetic because I slept in 10 minutes, then woke
Oh
up.
my goodness, you are just
Yeah, I'm something. Yeah.
something else.
Yeah.
I went upstairs to go see my children.
Yeah. Okay, so if you're a 37-year-old woman with vertigo, postural instability, and vomiting, and buzzing sound,
Vertigo, postural instability. Okay.
horizontal nystagmus.
Mm-hmm.
What's next step? How do you treat? So this is Meniere disease. You give them low salt diet.
Mm-hmm.
Okay. Now, if you're a 24-year-old female with painful ulcers in the mouth and chronic abdominal pain and diarrhea, and the ulcer shows granulomatous inflammation, what's your diagnosis?
Painful ulcers in the mouth.
Yeah.
Okay. Crohn's.
Crohn's, yeah. If you're a 78-year-old woman, when I examine you, left external auditory canal is edematous with a purulent discharge and granulation tissue in the floor. ESR is 89. How can I treat that condition of malignant otitis externa?
What is the treatment again for malignant? You give a anti-pseudomonas.
You give them IV ciprofloxacin.
Mm-hmm.
Yeah, that's it. Now, if you are a 33-year-old female with episode of sensation of severe spinning that lasts 2 hours and accompanied by nausea and fullness in the ear.
Mm-hmm.
So what is your diagnosis here?
Fullness in the ear. Any history of a UTI or any history of infection or anything?
No, this is a Meniere disease.
This might be Meniere's disease.
Yeah,
Okay.
Meniere disease, like nausea, spinning, fullness in the ear. Meniere. Okay, if you're a 43-year-old nurse who have hepatomegaly and heartburn and positive anti-HCV antibody, what's best next step? Then we gotta vaccinate you for hepatitis A because you have chronic kidney disease with hepatitis C. So that's the treatment for that. Okay, if you are 53-year-old woman, when lightly brushing the skin on your right of the umbilicus elicit intense pain, What's your diagnosis?
Varicella.
Shingles, yeah, herpes zoster. Okay, if you are 44-year-old male with a total on TPN. Okay, so what could cause gallstone here?
So a patient is on total TPN. That means that the gallbladder is not the CCK is not working to contract the gallbladder.
Yeah, right.
So stasis.
Yeah. Good job. If you are a 66-year-old woman with a 3-day history of diarrhea and 3 to 4 episodes of non-bloody watery diarrhea, and you have end-stage renal disease, hemodialysis, when I do rectal exam, I found DIAC positive brown stool. What's best next step?
Non-bloody diarrhea in an end-stage renal disease patient?
Yeah, and you're taking omeprazole daily.
You're taking omeprazole daily?
Yeah. So this omeprazole is a risk factor for C. difficile colitis, so I'll do assay for bacterial toxin. Okay, you have 3 non-bloody diarrhea, so that's typical. If you're a 69-year-old male present with nausea, fever, and for the past 2 days, and you're urinating more frequently than usual, on exam there is tender to palpation in the lower left quadrant. Costovertebral angle tenderness is absent. So what's best next step?
CT.
Yeah, this is acute diverticulitis, abdominal pain, nausea, vomiting, fever, ileus due to peritoneal irritation. We do CT, oral or IV contrast. Management is bowel rest, antibiotics, Cipro and metronidazole. Complication can cause abscess, obstruction, fistula, perforation. That's the thing. Okay, now if you're 43-year-old male with a 6-month history of intermittent upper abdominal pain associated with nausea, the pain improved with leaning forward. Okay, what's best next step?
Yeah, CT.
Yeah, CT. This is chronic pancreatitis. You treat it with pain management, alcohol and smoking cessation, frequent small meals, and pancreatic enzyme supplementation. Okay. The clinical manifestation can have chronic epigastric pain. Okay, intermittent could be malabsorption, steatorrhea, diabetes. Okay, so that's causes could be autoimmune, alcohol, cystic fibrosis, or cancer stone. Okay, amylase lipase will be normal, but CT will show calcification, dilated duct, enlarged pancreas. So those are the things. Now, if someone, a 70-year-old guy on warfarin and developed weakness, dizziness, and back pain, what do you suspect?
Hematoma.
Yeah, retroperitoneal hematoma. Good job. Now, if you're a 59-year-old male with vomiting without hematemesis and confusion, when I check AST, ALT, both around 7,000. Okay. So you're...
Is it like hepatic failure?
Yeah, this
maybe
is medication.
Overdose.
Yeah, medication-induced liver
Acetaminophen.
failure. Yeah, medication-induced liver failure. This is most likely. So this acute liver failure, etiology could be viral hepatitis A or B, could be acetaminophen, could be alcoholic or autoimmune hepatitis, could be Wilson, Budd-Chiari, ischemia, malignant infiltration. Present with fatigue, anorexia, nausea, right upper quadrant abdominal pain, pruritus, jaundice, hepatic encephalopathy. Okay, which worsen as the liver failure progress. How do you find it on lab? Lab, you will have increased PT, increased INR more than 1.5, increased transaminase, AST-ALT more than 10 times normal, increased bilirubin. You have worsening PT, INR, bilirubin, indicate progressive liver failure. Okay, so that's the idea of this. Now, if you're a 50-year-old male with AST of 200, ALT of 99, okay, Okay,
So
so
that's 2 to 1.
yeah. So you have fever and tender hepatomegaly, jaundice, anorexia, right upper quadrant, abdominal pain. So
Alcoholic hepatitis.
yeah, substance abuse, alcohol. Abdominal imaging may show fatty liver and alcoholic hepatitis. Yes. Okay, huh? You're here? Okay, yeah. So if you have chest x-ray shows widened mediastinum and barium studies shows dilated esophagus with the smooth tapering of the distal esophagus in a 62-year-old man. What do you do next?
EGD.
Yeah, EGD. See,
Might be due to cancer.
yeah, it's easy. It's not that hard. Like when you repeat it so many times, it'll be very easy. Yeah. Now, if you're a 22-year-old male with aversion to smoking and yellow sclera, what diagnosis?
Oh, aversion for smoking
Mm.
and yellow sclera.
Mm.
Hepatitis.
Yeah, hepatitis A.
Mm-hmm.
That's the thing. Now, if you're a 58-year-old male with anorexia, unintentional weight loss, dark urine and pale stool, you have enlarged non-tender gallbladder, palpated below the right costal margin. So what's your diagnosis?
So painless gallbladder. Yeah, gallbladder cancer.
It's a pancreatic cancer. This is called Courvoisier sign
Oh,
when you have enlarged. So intra
yeah,
and
painless jaundice.
yeah,
Okay.
intra and extrahepatic biliary tract dilation. Could be whatever cancer can cause that. Now, if you're a 36-year-old guy with the blood in your stool, what's best next step?
Blood in your stool.
Mm-hmm.
Okay.
Yeah, so
if it's like blood in your stool, if it's a bright red blood, you can start with going to the upper, do the EGD, and then
yeah. So this is what you do. Like when you have minimal bright red blood per rectum, minimal, not too much. If you're less than 40 years old without a red flag, you do anoscopy. If there is hemorrhoid, then that's a you diagnose it, treat it accordingly. If there is no further source, then we do sigmoidoscopy or colonoscopy. Okay, but if you're more than 50 years old with red flag, then I do colonoscopy immediately. Okay?
Okay.
Yeah. But if you're 40 to 49 without red flag, then you do sigmoidoscopy or colonoscopy.
Bright red blood.
Yeah. Now, if you are a 40-year-old guy with retrosternal chest pain with swallowing and epigastric burning, endoscopy shows circumferential deep ulceration with relatively normal surrounding mucosa at the middle third of esophagus. What's the diagnosis?
Deep ulcer, middle of the esophagus.
So this is
Circumferential.
pill-induced esophagitis. That's the description for it. Okay, ulceration in the esophagus. The pill, what type of pill can cause that?
So they said things like tetracycline.
Yeah,
Can cause
tetracycline.
it. Yeah, NSAIDs.
Yeah, aspirin, NSAID, aldronate, risedronate, potassium chloride, iron. Can cause that. So if you're a 65-year-old male with swallowing difficulty and foul smelling, change in breath, odor, what's the diagnosis?
Halitosis Zenkus.
Zenger is a motor dysfunction present mostly more than 6 years old in males, dysphagia, halitosis, regurgitation, aspiration, and variable neck mass. Diagnosis: you have barium esophagogram, you do esophageal manometry, open endoscopy surgery, cricopharyngeal myotomy. That's a treatment for Now, if you're a 50-year-old woman with abdominal pain and multiple ulceration of the duodenum and prominent gastric fold, gastrine is elevated. What other tumor you suspect in this guy?
Gastrinoma.
Yeah, so you suspect they may have parathyroid adenoma. Okay, because it's a men. They have gastrinoma.
Men 1.
Yeah, they may have parathyroid,
Pituitary.
and parathyroid left. Enteropancreatic, pituitary, and parathyroid. Now, if you're a 50-year-old woman who had several months of intermittent substernal chest pain, who has sudden worsening, present suddenly, what's the diagnosis?
Intermittent chest pain that suddenly worsened.
Yeah, sudden chest pain, and it's an esophageal pain. Endoscopy normal. Manometry shows
It can
simultaneous
be
contraction. Yeah. Can be MI. But when I tell you in the manometry shows simultaneous contraction of the smooth muscle, then what's your diagnosis? When I tell you esophagogram shows cork screw pattern.
Oh, that's the esophageal spasm.
Yeah, or manometry shows intermittent peristaltic multiple simultaneous contraction. They're present with intermittent chest pain, dysphagia for solid and liquids. Okay, due to uncoordinated simultaneous contraction of the esophageal body. That's why they have these symptoms. Treatment, calcium channel blocker. If they can't take CCB, calcium channel blocker, you give them nitrate or tricyclics. Okay. Now, 65-year-old guy who have adenocarcinoma of the stomach on EGD, you found that. What's next step? You do CT scan of the abdomen.
Yeah, for staging.
Yeah, and then you do so first endoscopy, positive for adenocarcinoma, you do CT scan of the abdomen and pelvis. And then you do PET CT, endoscopic ultrasound, laparoscopy, CT, paracentesis, peritoneal lavage. Okay, you do these things. If it's advanced, then chemotherapy, palliative therapy. If it's limited, just surgical resection. Simple and easy, right? Now, if you're 80-year-old woman with fatigue and taking aspirin, what's your diagnosis?
Taking aspirin, maybe insect-induced.
Yeah, iron deficiency anemia. Good job. Now, if you're 33-year-old male who's have tonic-clonic seizure and you're IV drug abuser, your ALT is 500, AST 500 too, antihepatitis C is positive, then what should you do vaccinate him on?
B and A.
Yeah, B and A. They repeat this concept so many times. It's very important.
It's good. Yeah.
Now, how do you treat cholesterol emboli?
Cholesterol emboli?
Yeah, acute pancreatitis cholesterol emboli.
I think it's supportive.
Just supportive and IV fluid, yeah. Now, if you're 27-year-old female with malaise, anorexia, and nausea, urine is very dark, examination shows yellow sclera and spider new on her upper torso, rigidity and tremor. Slit lamp exam shows greenish brown deposit around both cornea. What is that?
Greenish brown. What do you call Wilson?
Yeah, excellent, Wilson. That's it. It's associated with Fanconi, hemolytic anemia, and neuropathy too. So it's a messed up condition. It has associated with a lot of messed up diseases. Now, if you're a 76-year-old male with foul-smelling breath, fluctuant mass in the left neck, what's best next step?
Fluctuant mass. It might be foul-smelling breath.
Yeah, so Zenger diverticum, you gotta do contrast esophagogram. Okay, it's the test
Okay.
of choice to confirm diagnosis. And treatment is surgical. Now, if you have FOBT positive and MCV of 70,
If you're what?
positive FOBT
Mm-hmm.
and MCV of 70 and palpate hepatomegaly.
Hepatomegaly.
Yeah, that's colon cancer, causes decreased MCV. That metastasized to the liver,
Mm.
causes palpated liver below costal margin. 5 cm below costal margin. Okay, so those are the metastatic disease. Now, this is very important concept. If you're a 26-year-old man with abdominal pain, fever of 101, heart rate of 130, diffuse abdominal tenderness, white BCs of 31,000. So, what's your diagnosis?
White BC
Yeah,
is how much?
30,000.
30,000. A young male with fever, heart rate, white blood cell.
Yeah, so there are criteria for this diagnosis: abdominal pain, urgency, bloody diarrhea. One. Second thing, fever. Third one, white BC more than 12,000. Other thing, HB hemoglobin decreased 110.2. And the patient has long lasting of ulcerative colitis. Long.
Maybe toxic
Yeah,
megacolon.
toxic adenoma. So you gotta do X-ray.
Mm-hmm.
For that, toxic can be caused by C. difficile or IBD.
Mm-hmm.
Can be present with fever, tachypnea, hypertension, bloody diarrhea, abdominal distension, colonic distension. Management: bowel rest, NG suction, antibiotic, steroid if IBD associated. Okay, and then surgery if non-responsive to medical management. If he doesn't respond to NG tube, antibiotic, bowel rest, then do surgery, take it out. Now, if you're a 52-year-old man who's a smoker, so what could decrease risk of pancreatic cancer? So what are the major risk factors for pancreatic cancer?
Smoking.
Yeah, smoking, obesity, low physical
Hereditary.
activity, and non-hereditary chronic pancreatitis. Those are the environmental. And the hereditary ones: germline, BRCA1 and BRCA2, Fitzgerald syndrome, hereditary pancreatitis, and first degree relative with pancreatic cancer also. Because those are risk factors for pancreatic. If you drink a lot of wine and have fatigue, then most likely folic acid deficiency. It was funny, one time my internal medicine preceptor, he said like we should invent alcohol that has folic acid in it. Because, then that's my,
That is so funny.
yeah.
Interesting.
Yeah, now if you're a 64-year-old woman, on biopsy their lymph node revealed metastatic squamous cell carcinoma.
Lymph node.
Yeah.
What?
So,
Mets?
squamous cell carcinoma. Yeah, lymph node, cervical lymph node. So what should you do right now?
Squamous cell carcinoma. My brain is not working anymore. I'm just like sleepy.
So when you have when you have cervical lymph node with squamous cell carcinoma, then you gotta do pan endoscopy to look for the primary tumor, like esophagoscopy, bronchoscopy, and laryngoscopy. Now, what is the most pre-malignant for colon cancer?
For colon cancer?
Yeah, what are the findings on like what polyp? Is it
the polyp, you have the villus, you have the sessile, a vilotubulus, and then sessile.
Yeah, good job. It's the villus. Yeah, adenoma is the strongest, most dangerous one.
villain.
Yeah. Now, if you're a 52-year-old woman with pain in the right subcostal area that lasts 30 to 60 minutes, okay, even though you had a cholecystectomy a year ago, but now you have right upper quadrant pain. Okay, alkaline phosphatase 180, AST/ALT is around 80 both. Total bilirubin is increased. Ultrasound shows mild dilation of the common bile duct. So what do you do now? And what's your diagnosis?
Oh, I've forgotten that name. Something that has to do with cholecystitis.
Yeah, good job. It's called post-cholecystectomy syndrome.
Mm-hmm.
Yeah, you treat it with endoscopic retrograde cholangiopancreatography.
Yeah,
Can happen.
CP.
Yeah, this is stasis can happen post-operatively. That's it.
Mm.
Now, someone who's taking digoxin and amiodarone developed anorexia, nausea, and weakness. What's your diagnosis?
Digoxin toxicity.
Yeah, present GI symptoms like anorexia, nausea, vomiting, abdominal pain.
Mm-hmm. Mm-hmm.
Those are the early acute digoxin toxicity. But the chronic digoxin toxicity can cause fatigue, confusion, weakness, color, vision alteration. And the life-threatening one is the cardiac arrhythmia. Now, if you are 32-year-old Jewish woman with face turned yellow over the past 3 days, so when I ordered biopsy of the liver, I found dark granular pigment in the hepatocyte.
Mm-hmm.
What's your diagnosis?
Dubin.
Yeah,
Roto.
it's Dubin-Johnson syndrome.
Dubious black liver.
Yeah. What could decrease complications of diverticulosis?
Oh, so low increase in fiber. Yeah, increase fiber intake.
Yeah, an increase of fiber, vegetables, fruits. Good job.
Mm-hmm.
And the one that increases risk of complication is that heavy meat consumption, obesity, smoking, aspirin. Okay, those sorts of things. Okay, now if you're a 64-year-old male on flexible sigmoidoscopy, there is erythematous friable mucosa extending from the rectum to the sigmoid colon and small shallow ulcers. What's your diagnosis?
Honestly, I didn't hear what you said.
Huh?
I did not hear what you said.
There's a friable mucosa in the rectum.
Okay, friable mucosa in the rectum.
Yeah, so rectal involvement.
Mm-hmm.
And he's having chronic abdominal pain, weight loss,
Uh-huh.
and loss of appetite.
Yeah, you see? You see?
Yeah, which one involves the rectum?
Yeah, ulcerative colitis.
Yeah, and they have neutrophilic cryptitis.
Mm-hmm. Ulcerative colitis, yeah.
If you're a 23-year-old male with severe diarrhea, pruritus, and jaundice, and decreased quantity of bile, liver biopsy shows decreased quantity of bile ducts. What's the diagnosis?
Diarrhea. What else?
Diarrhea, pruritus, jaundice,
Mm-hmm.
and you have decreased quantity of bile duct.
Is primary sclerosing
It's
cholangitis.
primary biliary cirrhosis. Yeah, good job.
No, you said male.
Yeah, male. Yeah.
Yeah, they don't. Oh, it's male that has the sclerosing cholangitis. The females are the biliary cirrhosis.
Yeah, but that's not so this is called vanishing bile duct syndrome.
Hmm.
It has the same pattern as a primary biliary cirrhosis.
Okay.
Okay. Most common cause of duct is called ductopenia. Most common cause of ductopenia is a primary biliary cirrhosis, or it could be liver transplant. This patient had a liver transplant. It could be Hodgkin lymphoma, graft versus host disease, sarcoidosis, CMV, HIV, and medication toxicity. Those are the things. So how do you treat maltoma?
You treat them with the medications first, antibiotics. Those instead of triple, I think they do quad.
Yeah, omeprazole, clarithromycin, and amoxicillin.
Mm-hmm.
Yeah, and some of them they use CHOP, which is cyclophosphamide, adriamycin,
If that
vincristine.
doesn't work,
Huh?
if the antibiotics doesn't work,
Yeah,
then you do like those chemo medications.
CHOP, vincristine. CHOP, SC for cyclophosphamide, H for adriamycin,
Trimicin.
or CHOP plus bleomycin.
Mm-hmm.
Yeah, prednisone. Okay. Now, if you're a 35-year-old woman, male, with 2 episodes of bloody vomiting that occurred 1 hour ago, and you have heavy drinking, what likely explain hematemesis?
Maybe a Mallory West tear.
Yeah, but there is condition if you take aspirin and alcohol at the same time, and you
Mm-hmm.
develop the bloody vomiting, then this is called acute erosive gastritis.
Oh yeah,
Yeah, yeah,
and cocaine too.
yeah. If you're a 40-year-old male with
Mm-hmm.
difficulty swallowing solids and liquids, and you have regurgitation of undigested food and lost 11 pounds over the past 6 months, what's the diagnosis?
46-year-old male regurgitating food, weight loss, right?
Progressive dysphagia for solids and then liquids.
Mm-hmm.
So this is achalasia, okay, characterized by chronic dysphagia to solid liquids, regurgitation, heartburn, weight loss.
Mm-hmm.
Manometry, you will have increased lower esophageal resting pressure and
Mm-hmm.
incomplete lower esophageal sphincter relaxation and decreased peristalsis of distal esophagus. Barium esophagus causes bird beak sign. Management upper GI to exclude malignancy, laparoscopic myotomy, and
Mm-hmm.
pneumatic balloon dilation. Botulinum, nitrate, calcium channel blocker, all of those. You can use that too. Those can help too. Now, if you're a 53-year-old male with hepatosplenomegaly and right cough is swollen and tender to palpation, okay?
Hepatosplenomegaly.
Yeah.
What else?
And swollen right cough. What's your
Swollen.
yeah? What's your diagnosis?
Right cough.
Yeah. Why is that? Yeah.
Swollen right cough. Tenderness to palpate what?
So they have abdominal distension, hepatosplenomegaly. So this is ascites case. So anyone with ascites, you want to do paracentesis to detect what's going on here.
Mm-hmm.
Okay, so that's the thing. Now, if you're a 45-year-old male with 2 duodenal ulcer and a jejunal ulcer,
Mm-hmm.
okay, what's your diagnosis?
Zollinger-Ellison syndrome.
Smart, Zollinger-Ellison due to pancreatic enzyme inactivation. Mostly in 20 to 50 years old. 80% sporadic, 20% associated with men 1. Clinical feature multiple refractory peptic ulcer, ulcer distal to the duodenum, chronic diarrhea. They have gastrin more than 1000 in the presence of normal pH less than 4. Okay, endoscopy, one of the workup, and then we do CT MRI, somatostatin receptor scintigraphy for tumor localization.
Mm-hmm.
Those are for Zollinger-Ellison. Now, if you're a 48-year-old woman who's given analgesic and IV fluid, in a few hours you passed urethral stone in the urine with complete pain relief. Okay, after you came to the emergency room with with a stone.
Mm-hmm.
So what do you do now?
So they have already passed the stone. So just, give them advice on things to eat and not to eat and discharge them, right?
Yeah, no treatment this time, just to start them home. Job smart. Okay, so let's do really quick rapid review of the question that we did. Wow, I'm surprised that we were able to finish GI. It's a tough one.
Mhm.
It's a huge, yeah. I'm gonna sleep happily today.
I am ready to go to bed right now.
Me too, it's at 12 past 12 now.
My brain is fried.
Yeah. Yeah, but every effort that you are doing right now
Mm-hmm.
is gonna get paid for. You're
Mm-hmm.
gonna get the results. Okay, let's do a rapid review and then let you go to sleep. So IV Cipro for malignant otitis externa. Okay, let me just. Okay, no, like just rapidly. If you have spinning, nausea, hearing loss, earfulness, this is Meniere disease. You do hepatitis A vaccine for hepatitis C. Crohn disease associated with ulcer in the mouth. Shingles associated with pain after intense pain after brushing. Gallbladder stasis can happen post-operatively. In TPN, people are on TPN. We do toxin assay if someone taking omeprazole and presented with watery diarrhea. We do CT to diagnose acute diverticulitis, which is the left lower quadrant pain. Okay, and chronic pancreatitis too. We do CT. If someone you have retroperitoneal, you can have retroperitoneal hematoma if you're taking warfarin. Medication-induced liver can cause 3000 ALT/AST. We do endoscopy for a 60-year-old guy with burning esophagus. We do anoscopy if you're less than 40 years old with bright red blood per rectum. The management of NASH is by diet and exercise and bariatric surgery if BMI more than 35. Tetracycline, aspirin, aldronate, potassium chloride, and iron can cause circumferential deep ulceration in the esophagus, which is pill-induced esophagitis. Foul smelling in the breath and dysphagia, that's a zinger. Parathyroid, pituitary, and gastrinoma, that's a min one. Intermittent chest pain with dysphagia, that's a diffuse esophageal spasm. We do CT scan to stage gastric carcinoma. We give IV fluid and supportive care for acute pancreatitis. Wilson disease causes greenish brown deposition around the cornea. Contrast esophagogram if there is a foul smelling breath. We do that. Metastatic disease could be happening if there is a positive FOBT, decreased MCV, and hepatomegaly. Toxic megacolon require anemia, heart rate more than 100, HYTPC more than 12,000, and temperature more than 100. A lack of physical activity and smoking, obesity increases risk for pancreatic cancer. If you drink a lot of alcohol, you may have folate deficiency. We do pan endoscopy for someone who has squamous cell carcinoma and lymph node. Villus adenoma is the most dangerous one for cancer. ERCP for if there is a dilation of the common bile duct. If you have anorexia, nausea, vomiting, after starting amiodarone. That's most likely digoxin toxicity. Dubin Johnson have dark liver. Fiber decrease risk for diverticulosis complication. CMV and HIV can cause vanishing bile duct syndrome. Omeprazole used to treat triple therapy, clarithromycin, amoxicillin for maltoma. Acute erosive gastritis can happen when you drink alcohol and have non-steroidal anti-inflammatory drugs at the same time. Okay, let's see. You have a positive hydrogen breath test and lactose intolerance. Epigastric crepitation, that is esophageal perforation. If you have 4D, that's a pellagra. Foul smelling with weight loss and DZ loss doesn't correct, that's a celiac. Epigastric pain 4 weeks after pancreatitis, that's pancreatic pseudocyst. Acalculous cholecystitis, it's if you're on mechanical ventilation and develop right upper quadrant pain. Irritable bowel syndrome present with pain after relieved by stool. Hepatic adenoma in OCP. Adenocarcinoma of the esophagus associated with hiatal hernia. Hyperkeratosis and easy bruising associated with celiac. Zinc causes cluster lesion in periorbital lesion, and loss of taste. Ultrasound of the abdomen we do when alkaline phosphatase is around 800. NASH can cause metabolic syndrome and hyperechoic texture on ultrasound. Inflammatory diarrhea associated with ESR of 50. Fasting lipid profile, we can order it if the patient doesn't have gallstone or not alcoholic and have acute pancreatitis. Acute pancreatitis can be complicated to pleural effusion. If you have abdominal pain and gain of weight, that's a peptic ulcer disease. Succussion splash, that's gastric outlet obstruction. Management of hepatic encephalopathy to correct underlying condition, and then you give him lactulose, rifaximin. When you have dark brownish discoloration of colon with lymph node follicle shining through pale patches, that's a factitious. Diarrhea. Endotracheal intubation for hematemesis. Gilbert cause fasting hyperbilirubinemia. Angiodysplasia present with aortic stenosis and dark brown blood. Anyone with cirrhosis, we do EGD surveillance and we do ultrasound of the abdomen every 6 months. We do colonoscopy for someone with iron deficiency anemia. If someone with alarm symptoms, we do endoscopy and there's no esophagitis, then we do manometry, okay, or gastric scintigraphy. Asturianum imipenem meropenem, the one that kills Pseudomonas. Low salt diet is the treatment for Meniere disease. And that is it. That's the summary for the GI system for today. Do you have any questions, concerns?
No.
Okay, I'm glad that I'm done with the GI now. I'm feeling better. Yeah.